Simply Motsoka.
Good morning, Sister Lungi. How are you?
Wow, how are you, Motsoka?
I'm very well,
Good.
and thank you for coming to the interview.
Oh, it's a pleasure. It's a pleasure.
I really, really appreciate you coming here and making the time. And you look very beautiful in your uniform.
Thank you.
Yes, that's very stunning.
I appreciate the time. Thank you for having me.
It's a pleasure. It's a pleasure. Before we start, I just wanted to find out from you, for viewers that are watching, what are the 5 things that a woman can pack if they're going into labor?
Okay, so we'll start with as a mom, right? So the first thing that is just at top of mind, sanitary towels, right? So you get maternity pads that are a little bit different from your usual pads, but if that's the option that you have, like the ones that you usually use at home, then you can go for it. So that's one. And secondly, obviously you need some underwear as well. So you have very special maternity panties that sort of accommodate you as a new mom, having gone through all those changes with your abdomen that are so stunning, with those beautiful art strikes and stripes on your belly.
Yes.
And the third thing is just obviously just to take on something fresh, to wear, some cosmetics, just to freshen up as well with. I think top of mind, I'll leave it there for the mom. And then for the baby, you can pack things such as, obviously you can't leave the nappies behind, right? So nappies, a little wrap for the baby, a hat, extremely important for the newborn. And just you don't need to bath the baby, so you don't have to pack any soaps and stuff post baby's birth, so we usually don't advise that you bath the baby immediately after birth.
Okay.
Because and especially because we have these very nice cream, or I'll call it nice because I know what the importance of it is, but there's this the white creamy it looks like lotion. In essence, it actually is lotion, but it's not. So when the baby comes out, they come out with this very thick cream on their skin. So we call it vermix.
Oh, I didn't know that, and I have 2 babies. Okay.
So that's amazing. It's just part of God's wonderful plan of creation. So what that actually does is that it helps babies' temperature to be regulated, and so we just really, really encourage that you keep that for as long as possible. Obviously, the baby does need to take a bath at some point, but we usually don't do it immediately after birth as we used to in the past.
Yeah, that's very interesting. We're going to talk about that a bit later.
Okay.
But thank you so much for coming to have this conversation with me.
Thank you for having me.
So now we're going to get into the crux of this so that people can know who you are and what you do. If you don't mind, just to tell everybody who you are and what you do. And obviously you're wearing some uniform. They can have an idea, but it would be lovely for you to just share with us who you are and what you do and what has been your journey just in the beginning.
Okay. All right. So my name is Lungile. Surname is Gamede, and by profession I'm a midwife. But I have also some competency, well, not some. I am qualified as a psychosocial nurse, as well as a primary healthcare nurse as well. So I trained at the University of the Witwatersrand, commonly known as Wits University. And that's where I obtained my bachelor's degree in nursing there. So it was a 4-year degree, with the last year being our honors year. And it was a very challenging journey.
I can imagine.
Very, very challenging, but it's the love that's the fuel, you know? So you always just look at the goal, like, okay, I see myself there on the other end of, chowing course. That's what we used to call it back
Yes.
then.
I always say nurses are the ones that look after patients more than the doctors, because we see you a lot.
Yes.
Yes. Wow, that's very interesting.
Yeah.
And then how did you finish? It took about how long?
So the course is 4 years.
Mm-hmm.
So I started in 2014.
Okay.
Graduated 2017.
Mm.
So yes, the course takes 4 years.
And you did it on record time.
By God's grace, you know it.
You did it on record time. Okay.
Yeah.
Wow, that's very interesting. And can you tell us what exactly is a midwife, and what does a midwife do?
Okay. So very interesting question, because I'm also just going within and trying to just reflect on this as well. But basically what the word midwife means is with the women.
Okay.
So that's the whole meaning behind the word. And yeah, essentially that's what we do. We are with the women throughout the process of pregnancy, labor, and also just a few months after the child is born. We call that the postpartum period.
Yes.
But also midwives play a very, very integral role in like the preconception phase as well.
Okay.
So if you are a woman and you would like to conceive, it is also the midwife role to sort of give you some guidance around that period and how to go about health behavior during that time.
Yes.
So that's what we do.
Oh, so I should consult with you. I'm planning to bring another one on there. No, seriously. Seriously, I'm contemplating. So maybe I should enjoy my coffee for now. Because I might not enjoy it later. Okay, that's quite interesting. And it sounds like it's very sensitive and you need to be always paying attention.
Yes.
And then how do you support women? I mean, I remember with my second baby, I was so nervous. My child came around the time of COVID, and I was so envious about how am I going to do this? I mean, COVID is here, people are not at the hospitals. How would you support women? I mean, how do you guys support women in that stage where maybe you're anxious about birth? What is the borderline between your role and the gynecologist, and how do you guys match each other?
Okay, so I think I'll start with the latter question, right?
Okay.
Just the distinction between the doctor and the midwife, the OBGYN. So basically with the midwife, we take care of uncomplicated or low risk pregnancies.
Alright.
Once there is a complication, for example, a mommy comes to me who's had a previous cesarean section, then that is now the doctor's patient and no longer mine, because by virtue of the fact that the lady has gone through a previous C-section, then it is a risk.
Oh, I see.
So that's basically just the distinction. So low risk, mommy is fine, no complications, no underlying conditions. It is the midwife's patient.
Okay.
And then once there is a complication, then it becomes high risk, and it now becomes the obs and gynae doctor who then looks after the lady.
Okay, I see.
Simply Motsoka.
Now tell us, what are the challenges that as a midwife faces on a single day in your job? What are those critical challenges that maybe you can share with us?
Phew. Well, first of all, it is a very unpredictable, profession. Like, we do not have a routine. So it's not like
like I wake up, I'll switch on my laptop, and now I've got these emails to read, like how we are.
Yes.
Oh my goodness. Okay.
So it's definitely not routine based, and anything can happen. So it's very important just to always, for me, beyond just being knowledgeable, which is extremely important, but it's just the ability to be there.
Okay.
Going back to how we started the conversation when I first, defined what the word midwife means. Like, you're there, you're with the woman. So when you're there, you are like able to sort of pick up things, and you're able to merge your skills and the compassion. When we were still in school, we were taught something that never left me, that nursing or midwifery it's both a science and an art. So I always take that with me, even in practice, that yes, you need the science, you need the knowledge base, but you also need the art of caring as well. So for me, that's how I cope. However, there are challenges, where, for example, I work in a public hospital, and there are some very unique challenges that we face there that sometimes make, I guess, being there fully very tricky and challenging, because of, for example, sometimes we low staffed, but yeah, there are ways to sort of go around that, and that's teamwork.
Yes.
And just constant communication with your superiors, just communicating in time. For example, if you are the shift leader at that point in time, then you just report that, okay, today this is the situation. We don't have so many nurses on duty and midwives on duty, so we would like to just raise that as a flag so that there's assistance in that regard. And then after that, we then communicate as a team and we see how we work it out. So teamwork is extremely important.
Yes.
In that kind of setting.
Sure, I can imagine that is stressful. I mean, already someone who's coming to give birth, they're already on their own at a very high level of stress.
Mm-hmm.
And you have to calm them, and your resources, and you are understaffed, and all those things.
Mm-hmm.
Sure, I really hope that in future that we can have some sort of a solution on that. But are there not enough nurses around, or is it because of how the current structures are being set?
Wow, that is... So, yes, we do not have enough nurses in the country. We actually don't. And the situation may just be, it definitely will be exacerbated if nothing is done at the moment. Because one of the very unique things about the nursing, so in South Africa, nurses are also midwives, So that's something maybe some other countries don't quite have. So, for example, here, I'm a nurse, but I'm also a midwife, right?
Okay.
So, nurse midwives in South Africa are an aging profession. So midwifery is an aging profession, and by midwifery I also mean nursing, right? In that a lot of the nurses that we have at the moment are actually over the age of 50.
Okay.
So the stats as revealed by the South African Nursing Council reveal that in the next 10 years or so, about 50%, just around 50% of our nurses will be retiring.
Oh my word.
So, yes, so the situation, so over and beyond the shortage that we have now, in the next 10 years, if nothing is done right now to effectively recruit and also retain
and train as well,
then we are going to be in a serious mess as a country.
Sure.
And COVID has not made things easy because it was a very stressful period for a lot of healthcare professionals, where you found a lot of them either going out of the profession altogether or being recruited, or going to find, like greener pastures in like higher income countries. So I think there's just a lot that needs to be done in that regard, and just, I guess, recruitment. But I feel like sometimes we focus on recruiting and less on what are, some of the retention strategies that we can sort of implement. Especially in the public health sector, to retain young midwives and nurses. But also we have had challenges in our in nursing education just over the last few years, where curriculum has been changed, so that whole process is sort of delayed.
The transition.
Yes, the transition has delayed quite a bit of nurses being recruited and trained, especially specialist nurses, because some programs had to be paused because some institutions had not been accredited, and it was just a bit of a tricky one. So we need to pull up our socks as a nation, because, because also nurses and midwives in like public, in general, right, in healthcare facilities, they make up the bulk of like healthcare workers. So we call ourselves the backbone, of the healthcare system in South Africa. And like I think you did mention in the beginning that nurses are the ones that are usually there with the patients.
Yeah, you guys are the core.
Right. So if we
Yes.
don't have enough, then what is going to happen to our healthcare system?
Wow, that part I didn't know.
Yeah.
Yeah, I didn't know, and I hope that this interview, maybe we could be having some people that are watching, so that we can get some help. And
Yes.
I really appreciate that. I didn't have any idea.
Mm.
I always thought of nursing as a profession that everyone just goes to work and everything is laid out. Because we, from a patient's point of view, we just see a schedule with everything with a structure, and we have no idea of the struggles that are behind the scenes. And to my honest opinion, personally, everywhere I've gone, I've always dealt with nurses that were always nice and very good. But now I want to ask you something. You don't have to mention figures. So if I considered, or anybody watching is considering moving into this field of being a nurse, what is the process like? And, earning structures? And you can just speak on a high level. If I consider to go into nursing as an industry, what are some of the tips that you can give?
Okay. So right from like the route, where do you train?
Yes, and all those.
Okay.
Yeah.
Okay. So in South Africa there are 2 routes.
Okay.
In fact, let me start with this. There are categories of nurses.
Yes.
So we have what we call enrolled nurses, or before enrolled nurses, they are auxiliary nurses.
Okay.
Okay. So auxiliary nurses just go through a certification journey. They acquire a national certificate, and then they qualify to become
Okay.
auxiliary nurses. And then there's another group of nurses called enrolled nurses, where they go through a 2-year certification journey as well. And then we have another group of nurses called professional nurses. Okay, so as a professional nurse, you either have an option of going through the university route and getting a degree, or you can go through a college route and get a diploma.
Okay.
So the difference is that when you go through, as the structures are at the moment, when you go through the diploma route, you only qualify as a general nurse. So you do not have any specialities. You can't be a midwife with that qualification. You can't go into psychiatric nursing, and so forth. Whereas if you go through a university route, you qualify as both a general nurse as well as a midwife.
Okay.
So at the moment, that is how things are structured. And then should you wish to specialize further, say for example, you would like to become an advanced midwife, where you gain more independence, you are able to do some procedures independently, then you go through it depends whether you're doing it part-time or full-time, whether it's a year or 2, and that is like a post-basic qualification. It's an advanced diploma.
All right.
Yes, and then I guess it depends really on what you
the path that you want to take.
The path, yes.
Yeah, because I've always noticed that I've had I think 3 operations. There's always been a nurse in the theater doing instruments. That's a different type of nursing. That's a different type of qualification or specialty as well. Okay. Yes, I wanted to find out from you. Let's assume now you are my my midwife for 9 months, and then, for example, something takes place and I can't give birth naturally, and I have to go to theater. I can request for you to be present in the labor. Oh, okay.
Yes. In the theater. Yes, to catch the baby. So that's also what midwives do in a theater setting.
Okay.
Once the doctor who's operating on you, usually the OB/GYN, then hands over the baby straight to the midwife.
Okay.
Which can usually be the midwife that has been taking care of you. Yes. Depending on whether you go through a private or and then so what the role of the midwife would be in that instance would be while the doctor is busy finishing the procedure with the operation, the midwife would then take care of the baby, keep the baby warm, and ensure that you see your baby.
Yes, I want to see my baby. Yes.
See your baby, you identify your baby, and then there's this very beautiful thing that we call skin to skin. So you
and you help also with, I remember they said they had to help with how to breastfeed and all those. Oh, very stressful, I tell you.
So you need I think the midwife is very, very key there.
Okay.
Because breastfeeding within the first hour is very important for you and the baby, actually.
Is it? I thought it was for the baby. I didn't know about the mom.
It is very. So what happens is that with breastfeeding, it actually helps to contract your uterus.
Oh, Kaba.
Yes. And to also help you to prevent bleeding.
Oh, okay. I didn't know that.
Yeah. So sometimes some women actually they complicate, especially, after the cesarean section, where we call it,
It's okay.
My colleagues would be so shocked that I don't know why it slipped my mind at the moment.
You will tell us, we'll pop it on the screen, don't worry.
Simply Motsoka.